Oklahomans are speaking out about Governor Fallin's recent decision not to expand Medicaid or create a state-based health insurance exchange. Deluged is the word used by those in the House Speaker and Senate President Pro Tem's offices. For the governor, the big issue was money, but healthcare providers and their patients have other concerns.
After the governor's decision, political leaders were quick to react, predictably, along party lines. The telephone and email at the governor's office were also filling up with opinions. According to the governor's office, before her decision, phone calls and emails were running 4-1 against expansion. They are still tabulating responses from after the decision. For decades, Elizabeth Frost got health insurance from her job, but that recently changed.
I was employed for 30 years and I got laid off. I didn't have any insurance and I got sick, and a friend of mine told me about Good Shepherd, and so I came down and they were really nice, really professional, really helpful.
The Good Shepherd is one of 19 charitable health care clinics scattered across central Oklahoma, each with different hours of operation, and some only open a day or two a week. Elizabeth is now among the estimated 639,000 Oklahomans who have no health care insurance. She also falls into the group of people who now qualify for Medicaid. There are currently 44,000 children and an estimated 15,000 adults who qualify for Medicaid but have not enrolled. Craig Jones is president of the Oklahoma Hospital Association. He says his organization favored expansion of Medicaid and now is left questioning the numbers the governor used to justify turning down an estimated $3.7 billion in federal funds over the next 7 years.
Our opinion is that the governor's projections are high. It assumes 100% total enrollment when that has not been the experience in the past. It also takes into consideration those people that are currently eligible for the existing traditional Medicaid. In fact, probably half of the cost that she has projected, Oklahoma is already liable for.
At issue is the set of figures supplied by the Oklahoma Health Care Authority. Those figures also provide estimates for 75% enrollment, which supporters of expansion say is a more reasonable projection. Speaking on Fox News, Governor Fallin explained that her decision was based strictly on the cost and a 100% estimate of enrollment.
And I'm not sure how much it's going to cost me. We're estimating it's going to cost the state of Oklahoma hundreds of millions of dollars, and that money's got to come from somewhere. And then you take the fiscal cliff and the predictions that we could go into another recession if Congress doesn't get its act together. It's uncertainty for not only my state, but for the nation.
Craig Jones estimates that hospitals are passing along $500 to $600 million a year in uncompensated health care costs. And with the governor's decision, thousands of Oklahomans won't be eligible for health insurance, even with the federal government creating a health insurance exchange.
With the decision not to expand Medicaid, we're going to see this donut hole in there in terms of people who won't qualify for Medicaid, and in some ways even won't qualify for what the exchanges would produce.
On the issue of the state creating its own health insurance exchange, the governor told Fox News,
well, basically Oklahoma says thanks, but no thanks. And we philosophically have a disagreement with the Obama administration and the Affordable Health Care Act.
Julie Cox-Kain is Chief Operating Officer at the State Health Department. She agrees with the governor's cost calculations.
There's been a lot of conversation about whether or not we should consider 100% as the appropriate rate of people coming onto Medicaid. But I'll tell you, when a governor has to be faced with the decision of implementing an entitlement program, what that means is that anybody who walks in the door gains that benefit, and she's liable, and our state is liable for 100% of those costs by making that decision.
Dr. Robert McAfee is president-elect of the Oklahoma State Medical Association. He's also Regents Professor at the University of Oklahoma Health Sciences Center. Speaking personally, McAfee says the debate over the issue needs to be broadened.
When people discuss the expansion, a lot of times they ignore the benefits. They look at the cost, but ignore the benefits. Providing care to a larger number of patients earlier is obviously advantageous for Oklahoma. They can get back to work earlier, the cost is less. The whole issue has become so politicized, it is difficult to have a rational, fact-based discussion of the pros and cons.
For Dr. McCaffrey and Craig Jones, there is another concern that has to be figured into the equation, an element that goes past the bottom line of costs and savings.
Healthcare is a very personal issue, and it has such an impact on people's daily living and on their vocations. And I think it is a moral issue for us to say, what can we do? We may not be able to do it all, but I believe that we can do more than what we're doing.
You know, there are three aspects to a healthy society: education, health, and jobs, and they're all intertwined. You can't have jobs without good health and good education. Good education leads to better health and leads to better jobs, et cetera. So they're all intertwined.
Pam Cross is executive director of the Healthcare Alliance for the Uninsured. She works every day with people who don't have health care insurance. Cross says one reason healthcare expansion stirs controversy is the perception that people who don't have health insurance fall into a specific category.
Wouldn't we want those who prepare our food, who take care of our children and our elderly, to be as healthy as possible? These are often the uninsured. They play a role in our lives. They may not be visible to us, but they're our neighbors, our fellow church members. They don't fall into one category.
Elizabeth Frost had insurance through her job for 30 years until she was recently laid off and then became ill.
I didn't know what to do. I'd suffered for almost a month. I couldn't breathe. It was really bad, and I found out it was bronchitis.
A recent study creates a virtual network linking the 19 charity-based health clinics and the 12 federally qualified health centers in central Oklahoma to ensure their limited resources are reaching an increasing number of Oklahomans who need health care but have no insurance.
We have, since we began our work, brought people together to look at the needs, to come up with creative solutions, to identify the resources, and then to be very accountable in how we utilize those resources to help people.
Craig Jones at the Hospital Association says even with the Healthcare Alliance's best efforts, it does not reach statewide, and Oklahoma will never be able to spread health care to so many people all by itself.
There's no way, in my opinion, that the state can do this on its own. I believe that a partnership between private and governmental sources is going to be necessary.
Jones sees the federal government picking up the entire tab for the first 3 years under the Affordable Care Act as giving states breathing room to adjust to the changes. Breathing room Oklahoma, for now, does not want.